Ever feel like your bones are trying to tell you something? Well, they might be. Today, we're decoding the language of our bones, specifically when it comes to a serious concern, bone cancer. This is a topic that is often shrouded in mystery, creating an atmosphere of fear and uncertainty. However, knowledge can serve as a powerful tool in the face of adversity. Stick around because by the end of this video, you'll know the 10 warning signs of bone cancer that you should never ignore. This knowledge could save your life or the life of someone you love. Imagine your body as a giant city, with your bones as the foundation, the fundamental architecture that keeps the city upright. Now, if these foundations start to crumble, that's an immediate red flag. Something is wrong, and the city's structural integrity is at risk. This is what bone cancer does to your body. Let's dig deeper. Bone cancer is, simply put, a form of cancer that attacks this foundation. Just the words are enough to make you shiver, right? The thought of your own body turning against itself is terrifying, to say the least. But knowledge is power, and that's what we're here for. Before we dive into those crucial warning signs, let's take a brief detour to what is bone cancer. It's when those usually helpful cells in your bones get a little too ambitious and start growing excessively. These unusual cells can kick off their growth journey in any bone of your body, but seem to favor the pelvic or long bones of arms and legs. Picture these cells as rebellious entities, growing and expanding without considering the well-being of the entire structure. Now, you might wonder why we're so focused on this. Trivia time. Is bone cancer a rare or common type of cancer? If you said rare, you would be right. Primary bone cancer, the kind that starts in the bone itself, is indeed a rare type. But don't let that rarity fool you, knowing its signs is as vital as the rarest diamond. Now let's crack those signs wide open, decipher them, and equip ourselves with the knowledge to spot them when they appear. Sign number 1, pain. This isn't your usual "I've worked out too hard" kind of pain. This pain sticks around. It's severe, often localized in the area of the tumor. You know how you feel a targeted pain when you hit your funny bone? Imagine that, but 100 times worse and more persistent. If the tumor is in a critical area, such as near a nerve, the pain may radiate to other parts of the body. Sign number 2, difficulty moving. Picture trying to operate a rusted old machine. That's what your joints might feel like if you have bone cancer. If suddenly you find it hard to move a particular joint or a bone, coupled with severe pain and swelling, your body might be hinting at something. This limitation in movement could also lead to a reduced range of motion in the affected joint or stiffness that doesn't go away. In this era of instant gratification, it's crucial to stay patient and take the time to understand what our bodies are trying to communicate. If you're finding this information helpful, make sure you hit the like button, subscribe to our channel, and don't forget to check out the description box for some useful resources. Back to those signs. Sign number 3, swelling. This isn't your typical "I sprained my ankle" kind of swelling. If you detect swelling around a specific bone, along with tenderness, heat, and redness, it could be a red flag. This swelling could start weeks or even months after the pain begins. It might feel warm or tender to the touch, and the skin over it might appear reddish, like a fresh apple. Sign number 4, numbness or tingling. This is not the pins and needles sensation you get when your foot falls asleep. This is a more intense, more disturbing feeling. Cancer cells in the bones might stress your nerves, leading to these sensations, causing discomfort and potentially leading to weakness. These sensations might be most noticeable when you're lying down or resting, disrupting sleep or rest times. Sign number 5, limping. Suddenly developed an unexplained limp. It's not because you're auditioning for a pirate role. It could be a sign of bone cancer, especially if coupled with pain and swelling. This could be more pronounced in the morning or after long periods of inactivity, and it might become more persistent over time. Sign number 6, fractures. Bone cancer weakens the bone structure, making them sensitive to fractures. Any sudden injury or even a small accident can lead to significant damage. Imagine the bones becoming as brittle as an old, dried-up stick. These are often sudden, unexpected fractures that occur from a normal or minor injury. Sign number 7, fatigue. Picture the kind of exhaustion you feel after a long day, but now imagine feeling that way even after a good night's sleep. It's a pervasive fatigue that doesn't get better with rest. It could be accompanied by other general symptoms like feeling unwell or having a decreased appetite. Sign number 8, weight loss. This isn't the weight loss from your latest diet or fitness regime. If you're shedding pounds without trying, and no, that's not usually a good thing, it could be a symptom of bone cancer. This unexpected weight loss is often accompanied by loss of appetite and changes in eating habits. Sign number 9, anemia. Imagine running a car with an insufficient amount of fuel. That's what anemia feels like for your body. A shortage of red blood cells in your body could indicate bone cancer and might show itself through symptoms like shortness of breath, weakness, and fatigue. Symptoms of anemia like paleness, feeling cold all the time, and experiencing fast or irregular heartbeats could also occur. And finally, sign number 10, fever. This isn't the kind of fever that comes and goes with a common cold. If you're experiencing a persistent low-grade fever that doesn't respond to over-the-counter medications, it could be your body waving a warning flag. It may also be accompanied by night sweats or chills. Before we move on, let's discuss another important aspect, the stages of bone cancer. Similar to a story, bone cancer has different stages, from 1 to 4, with each stage indicating a progression of the disease. Stage 1 is localized, while Stage 4 means the cancer has spread to other parts of the body. The prognosis can vary dramatically depending on the stage at which the cancer is diagnosed. Stage 1. The cancer is still localized within the bone, like a small group of dissenters not causing too much trouble yet. Stage 2. The cancer has grown but hasn't invaded neighboring areas, like a rebellion expanding but yet to attack the surrounding regions. Stage 3. Now the cancer is present in 2 or more places on the same bone. Imagine a series of minor disturbances across a city. Stage 4. This is the most severe stage where the cancer has metastasized or spread to other parts of the body, like a full-blown invasion targeting different parts of the city. It's vital to understand that early detection dramatically increases the chances of effective treatment. The earlier the stage, the more localized the cancer, and the more likely it can be successfully treated. That's why knowing these signs and getting checked out if you suspect something can truly make a life or death difference. Having this insight, coupled with the knowledge of the warning signs we've just discussed, puts you in a stronger position. It empowers you to speak your body's language and take the right step to ensure you're looking out for your health. So, you're now fluent in the language of your bones, at least when it comes to spotting bone cancer. We've armed ourselves with the knowledge, and now it's time to discuss the prevention. Prevention may not always be possible, but leading a healthy lifestyle, exercising regularly, eating a balanced diet, and quitting smoking can lower your risk. Remember, just like a car requires regular maintenance to stay in good shape, your body needs regular health checkups. They are like taking your car for service. They keep you running smoothly and help catch any issues early. And always remember, if you're experiencing any of these symptoms, don't wait. Contact your healthcare provider and get checked out. It's like seeing a crack in your house's foundation and immediately calling a professional to examine it. Better safe than sorry, right? Thank you for joining me on this health journey. If you found this video helpful, give it a thumbs up and share it with others. If your bones could talk, they'd say, subscribe to this channel for more great health advice. Remember, your body talks, and it's time we all started listening. Catch you in the next video. Stay healthy.